Will AI replace radiologists? The 2026 verdict. In 2016, a pioneer of modern artificial intelligence, Jeffrey Hinton, made a radical prediction that sent shockwaves through the medical community. He famously stated, "We should stop training radiologists now. It's just completely obvious that within 5 years, deep learning is going to do better than radiologists." Fast forward to today. It is 2026. 10 years have passed since that terrifying warning. The data tells a staggering story. The FDA has now authorized well over 1,400 AI-enabled medical devices, and a massive 76% of them belong to just one specialty, radiology. From automated chest X-ray screening to rapid CT scan triage for strokes, AI has officially penetrated almost every imaging pipeline in modern hospitals. So, did Hinton's prediction come true? Has the algorithm finally killed the radiologist? The short answer is no. But the long answer is far more complicated, and it is reshaping the entire landscape of medical school applications, hospital budgets, and patient safety. Here is what is actually happening inside the reading rooms. The reason everyone panicked. To understand why everyone panicked, we have to look at what AI is undeniably superior at doing. Radiology, at its core, has a fatal human flaw: fatigue. A typical human radiologist might look at hundreds of thousands of individual images a day, from complex slices of a chest CT to subtle mammograms. By the 8th or 9th hour of a shift, cognitive fatigue settles in. Human eyes miss things. Tiny, sub-millimeter pulmonary nodules, microcalcifications, or hairline fractures can slip through the cracks. AI doesn't get tired. It doesn't need coffee, and it doesn't experience a 3 p.m. slump. Computer vision algorithms excel at pixel-level pattern recognition. They can scan an entire image instantly and flag anomalies with perfect consistency. In fact, advanced workflow tools are now deployed in emergency departments worldwide to automatically triage critical cases. If a patient comes in with a suspected acute stroke or an intracranial hemorrhage, the AI analyzes the raw CT data the second the scan finishes. It instantly bumps the positive scans to the absolute top of the doctor's reading list, saving critical, brain-saving minutes before a human has even opened the file. Furthermore, we are now seeing the rise of vision language models. These are advanced systems that don't just look at an image, they generate structured descriptive text and draft preliminary reports. With algorithms performing rapid triage, pinpointing subtle lesions, and drafting text, it is easy to see why medical students are looking at radiology residencies and asking themselves a terrifying question: am I choosing a career that will be obsolete in a decade? Part 2. The reality check. But this is where the hype cycle crashes into the messy reality of clinical medicine. To believe that AI will fully replace a radiologist is to fundamentally misunderstand what a radiologist actually does. Spotting a dark spot on a lung scan is only about 10% of the job. The remaining 90% requires advanced clinical synthesis, context, and human judgment, areas where AI completely falls flat. First, consider the issue of clinical context. An AI looking at a chest CT might spot a patch of inflammation and tag it as pneumonia. But it doesn't know that the patient is a severely immunocompromised oncology patient who underwent a specific bone marrow transplant 3 weeks ago. It doesn't know that this specific pattern, in this specific clinical context, actually indicates a rare fungal infection or a drug reaction. Human radiologists don't just read images, they correlate pixels with a patient's entire chart, their lab values, and their history. Second, medicine is full of massive gray areas. AI algorithms are trained on tightly curated datasets, meaning they expect clean inputs. In the real world, patients move during scans, artifact lines appear across the images, and anatomical variants can totally confuse a rigid model. When presented with an anomaly it has never seen before, an AI can confidently misinterpret the finding, a phenomenon known as an AI hallucination. In medicine, a hallucination isn't just a glitch, it's a lawsuit, or worse, a fatal mistake. And finally, there is the massive question of legal and ethical accountability. If an autonomous AI completely misses a malignant tumor on a routine scan, who is held responsible? The hospital? The software developer who coded the algorithm? The technician who ran the machine? The legal framework of global healthcare requires a licensed, human professional to sign their name, risk their license, and take ultimate responsibility for the patient's life. 2026 verdict. So, what is the ultimate verdict? The global radiologist market is facing an unprecedented crisis, but it isn't a lack of jobs. It's a massive, severe shortage of workers. According to international health metrics, the global shortage of radiologists is projected to surpass 40% by 2030. Imaging volumes are skyrocketing due to an aging global population, and human doctors simply cannot keep up with the sheer volume of data. AI is not arriving to steal jobs. It is arriving as a desperate rescue mission to prevent massive physician burnout. The career isn't dying, it is evolving. The future of medical imaging belongs to a hybrid model. The most accurate diagnostic force on the planet is no longer a human doctor, nor is it an advanced AI. It is a human radiologist paired with an AI assistant. Instead of spending valuable time on tedious manual tasks like counting individual lung nodules or measuring the exact volume of a tumor slice by slice, the radiologist can let the AI handle the grunt work. The algorithm acts as a hyper-vigilant second pair of eyes, running quality checks in the background and populating templates, while the human doctor focuses their energy on complex, highly nuanced clinical decision-making. Jeffrey Hinton was wrong because he viewed the profession as a simple game of image recognition. Medicine is far more complex than that. So, if you are a medical student or a tech enthusiast looking at the horizon, remember the definitive maxim that defines modern medicine: artificial intelligence will not replace radiologists. But radiologists who use artificial intelligence will absolutely replace those who do not.